we welcome the President of the Republic of South Africa. Thank you. We can all be seated. Good afternoon, everybody. The Excellency, the President of the Republic, the Minister of Health, Dr. Mkhize, and the Deputy Minister, the DG, fellow colleagues. I'm with my fellow colleagues from different provinces, the MECs of health from different various provinces in the country. Ladies and gentlemen, social partners, comrades and friends, I would like to welcome you in this August occasion and welcome you in the signing ceremony of the Presidential Health Summit Compact. This is a culmination of a long journey that has begun when most of us were not even born and espoused in the Freedom Charter about healthcare in our country. It's also a very long journey of the improvement of our health, in quality healthcare to our country and to our citizens. Indeed, as espoused in the Freedom Charter, we needed to bring back a system that is united, that will be able to offer such quality care. The journey has been having a lot of milestones, starting from the national plan and the white paper, a paper on the health transformation, and also our response as a country to the epidemic of the HIV/AIDS. Also the development of the 10-point plan in 2009, and of course the recent ugly events that we have seen, the tragedy of life as a demand, the oncology crisis in KZN, which by and large signaled an indication to us as a nation that something needs to be done and something needs to change. A lot of debate and discussion has occurred about whether we define it as a crisis or we define it change. But I think the Presidential Health Summit did ultimately have a last word on the matter, and it defined it that we are in a crisis. It's important that when we are here today, we realize that we stand, particularly at the dawn, what we know as a new dawn. We are standing at the door of a promise that we are going to pledge here today of providing quality health care to our people. This new dawn, as is said to be, is characterized by a paradigm shift that always has to define what healthcare system is all about. Healthcare system is all about service. Healthcare system is about service and care, and also about that we won't be able to do these things without one another. So we need to do it as a partnership. We need to be able to remind our citizens of the obligations they have to also keep themselves alive and healthy. Because part of this partnership has to speak to those facts. That when we go to this derby this weekend, President, our trauma departments will be full afterwards. Not irrespective that there is war or anything, but because people would have indulged and they were happy. But the happiness in our country, when people indulge and become happy, they normally fight each other. So they stab each other, they shoot each other, and it's something that this partnership must talk to, particularly to our citizens, to say that yes, we can be happy, but also we can be happy without hurting each other. We cannot be at war with one another. And our casualties will be one of the points, and our EMS services will be indulted with everything in that sort. So we are here also at the brink that we are going to sign this impact, but we are waiting the presentation of the bill of the National Health Insurance, which proclaims that the universal health coverage is the right and it's a necessary way to able to invest in our economy. Something that usually when people NHI, people against NHI, they actually forget the situation or the important fact about health, that health must not be seen as a cost, but it must be seen as an investment. Because a healthy nation will actually bring about good economic growth. And there are studies to show that this is what is supposed to be. So we should be investing in our health system. We should be putting more effort in making sure that our health system is functional so that our economy will grow. It's not a mistake, President, that our economy is not growing very well, and also our health system is ailing. So there's some correlation that we need to look about and think about. So those of us who are against NHI, the refunding, developing a good model, funding model for our public health system, our health system, must think about it in that fashion. So we are signing this compact today that as social partners, business, private, civil society, labor, workers, we put our signatures in making sure that we put the investment in the economy, which is the investment in healthcare. And there are people who say the only way to do things, the only way to say things is to do. So we are all welcome, and we are going to show you a brief video, and then we'll continue with the program. It's not going to be a long program. It's supposed to be short and compact. Thank you.
Patient comes in to see us. They put their lives on it. Good morning, housekeeping. We're going to be sending you over for an X-ray. What's your date of birth? You can't talk about quality and great outcomes, which we deliver every day here, if at its foundation we don't have safe care.
Safety for patients and visitors here starts when people set foot on the campus. We feel connected even though sometimes we never see the patients.
Ask questions, double check. We can never be too certain.
Making sure everything is very well sanitized in this hospital.
We have to make sure it's packaged properly, sterilized properly, all the biologicals and parameters have been met on a sterilizer, so that when they go to the end user, they do have a quality product.
Well, we get together as a bigger team before the surgery ever takes place, and we involve the patient as well in that process to make sure that we have the right patient, to make sure that we're doing the right procedure, and that we have the right instruments, we have the right lab studies, we have the right information on the patient.
Specifically looking at falls today, if you're not putting safety first, then you're really kind of missing a huge part of nursing. That is what we do.
And all of us are entrusted with that. You may say, well, they're coming to see a surgeon or they're coming to see a doctor. But the reality is those doctors cannot take care of a patient without everybody else who works here. Think about the job that you have here every day and ask yourself, how do I impact a patient? And I guarantee you, every single person can come up with not just one, but multiple ways that what they do impacts a patient.
A complete medical record is important. To have that information be accurate and at their fingertips will make the patient's visit be the best it can and get the best care they can.
Each menu is created especially for our patients here to reflect their dietary needs. Walking in at 7:30 in the morning, you're knocking at the same food service, so like, come on in. It gives you a good feeling.
To make sure that we get correct demographic information for the patients.
All the pieces and parts are there before the patient even gets here. Reimbursement translates directly to patient care. Dollars don't come in, there's no money to treat patients. So we want to be able to treat every single patient who needs to be treated.
Any patient that's in the hospital, I treat them how I want them to treat my family.
And then make them feel comfortable that they're here, they're going to be cared for, taken care of, that they should not worry. I'm going to lock the door up so it doesn't roll away on here, okay?
Overall, for our size, for our complexity, we have moved miles. It's not good enough just to be doing well in the measure that's out there. We should be defining what a new measure is, taking the care that we give to that extra level of excellence. The standard that's out there is the low bar. It's what they expect everybody to do. But you know what? We're the Cleveland Clinic, and the low bar is not good enough. If all of us could take a pause, ask ourselves, what do I do to make the patient's experience safer, of higher quality, and something we can all be proud of? What can I do to raise my bar, make it a little better for the next patient that I talked to on the phone, or the next patient I walked past in the hallway?
It's all about the patient safety.
You want people to walk around and say, I know why I work here. I come work at Cleveland Clinic every day because we have a mission to heal, and we have a mission to do the right thing every time for a patient, give them a great outcome, and send them back to have a productive life.
Quality and safety starts with me.
If every employee believes and comes to work every day thinking that the patient's safety and the quality of the outcome that that patient gets starts with that employee, we can't go wrong.
I wanted to come and say a word or two. I've looked around the room. I've seen a lot of faces. A lot of my teachers are around here, and it seems a bit intimidating now. Particularly Prof. Munukwane. I see, and yeah,
okay. Thank you. My dear South African fellows sitting here with me, would it not be wonderful if we can have this type of treatment in our tertiary sections of hospitals in South Africa? I think it would be wonderful. The question is not what Department of Health can do for me to get that. It is what can I do as well to make sure that this is happening. Dear Mr. President, Honorable Minister of Health, dignitaries, and all protocol observed, as not to leave anyone behind here this afternoon. This historical day will see the signing of the long overdue presidential compact. This compact will usher in a new dawn for South African healthcare, as it provides a clear direction for the implementation of solutions. This is a culmination of various sectors in the public and private healthcare via the 9-pillar work stream as is described in your wonderful magazine, glossary, beautiful book. The foundation of this healthcare systems are centered around an integrated and inclusive model that has active participants that are in the private and public sector, civil society, academia, and individuals. Without these components, there can be no collective effort in addressing a new healthcare system for all of us. Healthcare cannot function in itself without an integrated health team that has no empathy. Without empathy, social and environmental factors that lead to poor health outcomes cannot be addressed or identified. The onus falls on all of us as individuals and as organizations to change these situations, to be beneficial for all our communities. And within this paradigm, the compact utilizes a bottoms-up approach to reduce inequality and poverty that is so part of us in South Africa. As a collective, this compact will be used as a building block to achieve universal health coverage, primary health coverage, under an NHI funding model. The goodwill and enthusiasm of everyone who participated in formulating this document makes me proud to be a South African. And if we can keep this momentum, I have no doubt that we can achieve great success in future. Thank you to all my fellow colleagues for giving your time and energy, but most of all, to the presidential team under the wonderful leadership of Prof. Olive Shoshana. Mr. President, with your newly appointed Minister of Health and the energy emanating from the office of the DG and the Deputy Minister, you can rest assured that I think magic will happen. You've got a great team. I thank you all. Thank you.
I think we're moving quite nicely along. I also see Prof. Koto around us, one of the renowned laparoscopic surgeons in the country. I'm going to call upon the Minister, Honorable Dr. Mzweli Mkhize, who will come and say a word or two to the stage. Let's welcome the last applause.
There's a serious generational problem here. The program director is seeing teachers, I'm seeing classmates and people. His Excellency, President Ramaphosa, I want to also assure you, Mr. President, that the next time you see this video, it will be a South African hospital. It will be South African staff. It will be South African patients. It will be South African systems. This energy that Dr. Angelique Kutsi is talking about is in this house. So thank you very much for that. My colleague, Deputy Minister Joe Pasha, the MEC for Gauteng, and all the MECs who are here. I'd have liked them to wave so that everybody can see that we've got the full house. Please rise, don't mind, there you are. So all the provinces are represented. The acting CEO of George Mukari, Professor Ndimande, the principal of the Nursing College, the dean of Sefako Mahato, deputy chairperson of SANAC, the president of WUSA, the president of the Medical Association, the president of the HPCSA, as well as all the other councils, president of the Research Council and other statutory councils, traditional health practitioners and allied professions, and members of civil society, the academics from various hospitals, from various institutions, and the staff from various hospitals amongst us. I must begin by expressing my deep gratitude for the partnership that has led us here, launching an exciting initiative to revive the health system. It's been my pleasure and privilege to have been part of this journey with you for many years, but I particularly wish to recognize the President for taking a keen interest and supporting this process to strengthen the healthcare system. Singo Lakalaba. We applaud you. We applaud you for your unwavering leadership and commitment to protect the constitutional right of all South Africans to quality health care. It was indeed gratifying to come in and find the robust process underway, steered by compassionate and competent advocates. This instilled a great sense of confidence in me, and I soon found myself driving deep into the compact and implementing some of the recommendations before the compact has even been signed. The initiative is anchored by 9 pillars, which I would just want to highlight at this point. Pillar 1 is human resource for health. The labor capacitation of our healthcare system is at the heart of strengthening this sector. Any other intervention will be fruitless unless effective strategies are implemented precipitously. Brisk and clear policy framework, governance with integrity, leadership, effective management, continuous skills development, and training of are integral factors in strengthening the workforce. We must continue to work with strategic partners and pay attention to the occupational safety, health, and well-being of the workforce itself, because happy workers deliver quality health services. The methodology used, therefore, to design the roadmap for human resource development and management shall include forecasting, production, posting, retention, and continuous training and management improvement. We will ensure, therefore, that our interns and community service professionals are absorbed effectively in the system, particularly at the primary healthcare level and the regional hospitals. Frozen posts must be unfrozen, and critical posts are to be financed and occupied. This we are discussing already today as the National Health Council, both at national and provincial level. Top-heavy management structures of hospitals and clinics that have so often been characterized by unclear, redundant chain of command, coupled with poor role definition, will be resolved with clear accountability frameworks. The issue of delegations, all of that needs to be dealt with. Pillar 2 is access to essential medicine, vaccines, and medical products. The rising prevalence of communicable and non-communicable diseases have become a socio-economic challenge that will be tackled through this particular pillar. Interventions will include better supply chain management of equipment and machinery, the establishment of a centralized procurement system with decentralized ordering and purchasing, the development of a national policy on capital equipment purchasing, ensuring skilled persons are involved in the development of tender specifications. Additionally, an undergraduate curriculum to improve supply chain management skills will also be introduced so as to address the limited expertise in this particular area. The real-time communication between contracted suppliers and Department of Health shall become sine qua non for timeous delivery and prevention of shortage of medicines. We must also reduce SAPRA backlog of registration of medicines by prioritizing medicines for public benefit, cutting bureaucratic red tape that frustrates the accreditation of drugs registered overseas, and using automation and collaborative structures to introduce new medicines that will curb high burden of disease. The recurring problem of budgets that get depleted before financial end must be addressed. And we have said that the budgets for medication must be ring-fenced. Thirdly, the third pillar is to execute infrastructure plan. We will review, update, and execute the 10-year infrastructure plan to ensure adequate, appropriately distributed, and well-maintained health facilities. Everywhere you go, this issue arises, and even here, the President has been briefed on quite a number of issues that relate to the challenges of the infrastructure here. Infrastructure shall be prioritized and funded through a new model of public-private sector partnership to construct and maintain health facilities. We'll talk a bit more about this, not here, in the next few weeks. Existing infrastructure planning mechanism, excuse me, such as infrastructure unit support system consisting of national National Health and then Council for Scientific Industrial Research and Development Bank of Southern Africa will be reinforced. And here, we want to create a team that's going to be able to pilot the refurbishment and creation of new facilities, and we need to do that with speed. Fourthly, is engaging the private sector. It has been eloquently expressed already by Dr. Angelique Kusia, leading SAMA. Here we have to indicate that on a recent momentous occasion that our DG presided over just a few days ago at the Board of Healthcare Funders Conference in Cape Town, there was a launch of Health Federation of South Africa. This is an organization of private healthcare institutions which is committed to working together with the public sector to realize the Sustainable Development Goal of universal healthcare for all. Public-private partnership has long been a tense and unclear dialogue, but I'm quite happy to say now that this notion of ethical activism and human capital investment has established a common ground where real constructive dialogue is now taking place. So we have here family practitioners who are meeting together, looking at how they can be part of this national health insurance, both from the point of view of the fact that as family practitioners, they see this as the future, but also because of the continuous engagement amongst us between public and private. The fifth pillar is improving quality, safety, and quantity of health services. South Africa needs to adopt integrated people-centered health service approach, which is based on the WHO framework, which includes the following: that people-centeredness that puts people and communities at the center of the health system, integrated health services, which means promotive, preventive, curative, rehabilitative, and palliative services that are organized, managed, and delivered in a manner that protects the chain of care. Then the community-driven activation campaigns, social contracting, and investment. Scaling up of community-based health services to bring care closer to the people, developing the implementing guidelines on referral between public and private sectors, as well as between different levels of care to ensure cost-effective use of resources, and then, of course, developing technologically advanced management tools to monitor and enhance health services. Our people have become accustomed to long waiting times, poor outcomes, and client dissatisfaction. This will no longer be tolerated, and at all the healthcare centers will now be held to the highest standards of client care that are ubiquitously standardized. A national coordinated quality improvement plan in all health facilities, especially primary health care level, shall be implemented and policed by oversight committees. The sixth pillar is improving the health services, health efficiency of public sector financial management system and processes. We have heard and understand well the frustrations of a healthcare system that is scuppered by corruption, administrative inefficiencies. And I wish for it to be known that the ministry will no longer tolerate corruption in this department, and that we regard poor administration as a liability to the delivery of universal health care. We will swiftly move with the following steps. We'll ensure close collaboration with the Special Investigation Unit to prevent corruption and wastage. The Department of Justice should implement the use of special criminal courts for corruption and also put in place mechanisms to minimize political interference in procurement matters. Urgent attention will also be given to address accrued debt in the provincial departments of health and to ensure that management processes are in place to prevent a recurrence. A review of the existing provincial equitable share formula will be undertaken and updated based on a standardized and transparent approach. The HIV conditional grants have become quite unwieldy. We need to review this and investigate optimal formula that coincide with our drive to integrate the services. We know that tertiary centers feel deprioritized due to the grants not having changed for the last 2 decades. These centers are critical for tertiary level care, teaching, and research, and so an urgent review of the funding mechanism for this aspect of infrastructure will also be undertaken. The Office of the Health Ombudsman is undercapacitated and will therefore need to ensure that this is actually strengthened and beefed up so that it plays the role that it's supposed to play to process all the complaints coming from our patients. 7, to strengthen accountability mechanisms, we welcome the call for administrative structures to be subjected to robust accountability mechanisms at national, provincial, and institutional level with the current constitutional framework. National Department of Health will also review its organizational structure to ensure a harmonized reporting structure from national to provincial levels. A standardized system of the current health regulatory environment should also be conducted, and a reparative proposals be tabled. Platforms and mechanisms for working with other departments and sectors shall be established to remedy socio-economic, political, and environmental determinants of health. The 8th pillar is engaging and empowering community. It can only be appropriate that quality community-based care is community-driven to foster a sense of ownership and empowerment. Governance structures such as clinics and hospital boards require intensive review. Community health worker program, community workers programs compliance with the prescribed principles for service delivery shall also be strengthened. Undergraduate health professionals should also be effectively integrated into communities for shared training and development experience. We've also spoken about the role of traditional healing, and then the alternative, what we call alternative or complementary allied professions, their role in the community wellness programs as part of the primary health care. That discussion we will go into to look at how we integrate everything at that level. It will become a lot more important to deal with these, because for the rising tide of communicable and uncommunicable diseases, we need a movement at community level of activism to deal with and fight against diseases, to help prevention, to deal with palliative care, to deal with rehabilitation, mental health issues, and so on. So all of those issues require us to be able to work with a broad sector of stakeholders on the ground. The 9th pillar is developing an information system. In accordance with the World Health Organization resolutions of 2019, digital technologies should be used to enhance the coverage and quality of health practices and services. We'll do this by developing an information system that will fix the fragmented health system, guide policies and strategies, and to ensure good investment outcomes. Current health information systems will be updated and assessed to identify existing best practices and expertise to perform gap analysis. The National Department of Health will coordinate stakeholder forums to reach a consensus on the standardization of the health diagnostic and procedure coding. A baseline assessment will be conducted across the health sector to determine what infrastructure is available. So a lot of this has to be looked at, in particular the issue of a patient register, a national patients register or beneficiary register for all South Africans into the NHI. The issue of digital patient records has to be looked into, but also to look into the various systems amongst the various provinces to ensure that they're interoperable, so we can be able to operate from whatever the patient lands in. The patient must be able to be identified, and the records somehow must be retrieved in that process. So there's a lot of work that we are looking at this particular area, including going further to how to bring closer to our people a number of medication, particularly for geriatric, for chronic care, and so on, and those who don't need immediate attention from the doctors, where a program to bring them closer with e-prescriptions and so on, and use of drones, etc., to bring health closer to the people. All of these for us are some of the issues that were identified as part of this social compact, and we want to say that your role in bringing about that compact is highly appreciated, and we want to hold hands from now going forward under the command of our president to ensure that we don't lose each other. In the robustness of the debate that will be arising, we will need to be together. And indeed, we are highly honored today to have the president whose vision it was to pioneer the Presidential Health Summit, to mobilize the widest range of stakeholders to be here amongst us. He is known to have made the clarion call for every one of us to stand up and be counted, to be ready to be sent to Mamina. And of course, after the election, someone brought to the attention of the president that there was another song which was sung by Hugh Masekela, Beyond Tumamina. It was Kauleza. So he has now issued the instruction to us to Kauleza and to implement without further delay. Ladies and gentlemen, a leader of our country and the man who was the midwife of our constitution and the man who has brought about a huge hope at the new dawn for South Africa is none other than President Cyril Ramaphosa. Please rise and help me present to you the President of the Republic of South Africa. Mr. President, Singo, Bakala.
Thank you. Let's be seated, please. Oh, yeah, we can put it here. Thanks. Program Director, Dr. Bandile Masuku, Minister of Health, Dr. Zweli Mkhize, Deputy Minister of Health, Dr. Joe Pahla, the CEO of the George Makari Hospital, Professor Ndimande, Mapaseka Letseke, the Deputy Chair of SANAC, the MECs for Health, who have come from all our provinces, BUSA representative, Mr. Stavros Nicolaou, representatives from various public health entities, provincial and district senior officials of health, and members of the media, and ladies and gentlemen. Minister Mkhize, you said I'm a midwife of the Constitution. Maybe you should have said midman or something. But nowadays, particularly when I am with people in the health sector, I prefer to regard myself also as a doctor by marriage. Dr. Mkhize and I served in another NGO leadership corps, and he recalls that whenever people in our midst complained about one ailment or another, I would always say, I can also check you up. I'm a doctor by marriage. Colleagues, it's really my privilege to join you here this afternoon on what can be characterized as quite a historic occasion, when we will be signing for the first time ever a presidential health compact that binds us as a collective to overcoming and addressing the challenges in our public health system. In my first State of the Nation address in 2018, I issued a clarion call to South Africans that we should all seize the moment of hope and renewal and work together to make a meaningful impact on the lives of our people in South Africa. Since then, people from all walks of life have affirmed their deep love for our great country and their determination to see to it that our country does succeed and that it thrives. They've come forward and they've said, yes, Mr. President, to Mamina, send me. And Dr. Coetzee this morning said about creating real magic in the healthcare system together. And that speaks to the true manifestation of the spirit of Tumamine. There's nothing that reinforces this spirit as much as seeing government, health and allied health professionals, labor, business, communities, academia, tertiary councils, traditional health practitioners, and public health entities collaborating in the pursuit of a common goal. A new era, and one can say it more correctly, like Dr. Masuku said when he opened and welcomed us. Indeed, a new dawn has begun in the field of healthcare in our country. The signing of the Presidential Health Compact is indeed the culmination of a long journey that we have traversed and traveled together since we convened the Presidential Health Summit last year, which was really convened to try and find solutions to the crisis facing our healthcare system. It is fitting that we are signing this historic accord here at the Dr. George Mkhari Hospital, where a groundbreaking and difficult operation to separate conjoined twins was performed in 2017, which was conducted in collaboration with staff from the Nelson Mandela Children's Hospital and a number of other private sector doctors. This successful operation cemented what I would call the good reputation of so many of our public hospitals that often go unrecognized. This hospital is also the teaching facility for the Sefako Makgato Health Sciences University, the first health sciences university established in the post-apartheid era. The Sefako Makgato University campus was once the campus of the Medical University of South Africa, also known as Medunsa. More than half of all African medical doctors and dentists in Southern Africa were trained at Medunsa, and no doubt many of them are amongst us today. Our program director himself, who made sure to tell me that he is not only here as just a program director and an MSc for health, and that today he has been elevated, even if it is just for a brief moment, as an acting premier of the Gauteng province. And he was relishing the moment as he told me. But he was also trained here, and to demonstrate it as we were going through the hospital, he was telling me about the many escapades that he had in this precinct as a doctor trainee, so he knows this hospital very well. We acknowledge and celebrate the contribution of our pioneers who walked through the doors of Medunsa and who received practical training at this hospital. Many of them have blazed a trail as young professionals, and they have achieved great things. The signing of the Presidential Health Compact is part of our efforts to deepen cooperation and collaboration amongst all role players. Government, working together with various social partners, is embarking on a journey of the reform of our health care system. The collaboration we are forging will enable us to pool our knowledge. It will also enable us to pool our finances, our human capital, and various other resources, to pull them together in a very wonderful collaborative effort. And this collaboration will enable us to address the many challenges our healthcare system faces, as well as addressing the backlogs that many of us know about. We will be able to leverage development assistance and open up opportunities for community-based organizations to contribute to a better healthcare system. In my presidency budget speech to Parliament a week ago, I stressed the determination of this new administration to end the practice of government departments working in silos in a disconnected manner. Working in silos always leads to fragmentation of service delivery, to inconsistency in policy application, and to poor monitoring and evaluation. And this does not only happen in the health sector, it happens right across the various disciplines that government is involved in. I said that we would be moving away from working in silos and a top-down approach to development. We will seek to have a much more involved and integrated working model through which we will implement a real people-centered delivery process. This new decentralized approach, which focuses on service delivery at a district level, is perfectly aligned with the objectives of the Presidential Health Compact. By working in a collaborative way, we will be able to reach our goals much faster, much more effectively, and implement them efficiently as well, with the best use of the resources that we have. In fixing what is wrong with the public healthcare system, we are mindful of the impact of our past. We are mindful of the legacy of decades of skewed resource allocation and underfunding of facilities serving the majority of South Africans, especially primary health care. 25 years into democracy, we have made enormous strides in broadening access to health care for our people, in reducing the burden of disease, and in raising life expectancy. In 2020, a new medical school will be established at Nelson Mandela University in the Eastern Cape. And recruitment for new students is already underway. Dr. Ndimande, as we were going, or Professor Ndimande, as we were going through this hospital, spent the better part of our walk through the hospital, showing me, as he was showing me around, telling me what we need to do to replace this hospital with a new one. And he kept saying, this is an old hospital. Now, as we were walking, I made the mistake, and sometimes when you walk, you make mistakes. So I made the mistakes of putting my hand in my jacket pocket, and he immediately jumped for joy, thinking I'm pulling out a checkbook. He made it very clear that a new hospital is needed here. But my partner in walking together with him was Dr. Mkhize, the Minister of Health, who immediately agreed with him. And we started doing the numbers, and as I did the quick calculation, Minister of Health said, President, you are right, that is very close to that number. Please go and find the money for us. We have made enormous progress, and we will continue making progress, and healthcare being one of the key delivery areas for our government, we will pay attention also to issues like setting up new hospitals. It is significant that more than 40% of clinics that serve our people today were built in 1994. These are just some of the many successes of which we can be proud. Our mission is to reform healthcare, to make it better suited to the needs of an ever-growing population. We want to ensure that it becomes part of our movement forward towards equitable healthcare and to give our people the best access to healthcare. The targets set under Goal 3, ensuring healthy lives and promoting well-being for all ages, mirror the aspirations of the National Development Plan. To give practical expression to Section 27 of our Bill of Rights, which affirms the right of everyone to have access to health care services, including reproductive health care, the NDP sets out specific goals, priorities, and actions towards achieving a healthcare system that works for everyone. Ensuring positive outcomes by raising life expectancy, reducing the burden of disease, and reducing mortality is so much more than a health issue. A healthy nation is a successful nation. The transformation and effective resourcing of our health system is fundamental to our plans for building a just, equitable, and prosperous society. A healthy population is economically productive. It is a nation that is industrious and is the bedrock of any country's economic development. We are all aware of the challenges, and our challenges are quite enormous. But we are also aware of poor resource management, of underperformance in our facilities, of inadequate investment in people and skills, and of inequitable quality of care between public and private health care. We are here because we share a common vision of the South Africa that we want. A South Africa where our entire population will have equitable access to quality health care for themselves, for their children, for their parents, and for their grandparents. A South Africa where our public health system is a people-centered health system, which is responsive to people's needs and where the views of communities and ordinary people are valued and respected. A South Africa where our clinics and hospitals become centers of excellence, where they are well-resourced and adequately staffed. It is quite informative to see that audio and video this morning when we started. Of course, it paints a wonderful picture of what an ideal hospital or health center should be. And this is what, as Dr. Mkhize said, we want to be. We want to get there. And we can get there because we've got the capability of getting to precisely what they have. As we were going through the Nuclear Medicine Center, I was being told by the various doctors here that we are the only one on the African continent who have this and that and that, and they said we are world class. So here in this hospital, which is very old, we also have world-class type of areas of excellence or pockets of excellence. And these are areas that we need to spread around our country in various other hospitals. We convened the Presidential Health Summit last year to address the failures that have hampered our progress towards an integrated and united health system. I was greatly encouraged at the high level of participation, both in terms of the number of the delegates who were there and the quality of the inputs that were made by the various people who were at that summit. Following the summit, social partners turned their focus on developing the compact that we are going to be signing today. And I'm grateful for that. We have already seen and must applaud the broad commitments our various social partners have made to strengthen the public health system. One health service user group has committed to establish a corporate-funded youth employment initiative in the health sector that will train young people at risk to become lay counselors, data capturers, and community tracers. And we applaud this group for having done so. The private sector has a critical role to play in supporting government to train more young people who can continue the onward march towards the fourth industrial revolution. Another example is a collaboration between the departments of Science and Technology and Trade and Industry, working with science councils to establish an active pharmaceutical ingredients technology innovation cluster. This will have significant consequences for access to medicines into the future. In yet another example, health professionals have committed to promote the employment of community service professionals in rural areas, which is key to improving access to quality healthcare in the most far-flung areas of our country. The labor movement has also committed to supporting the Department of Health by reviewing policies around remuneration for work outside the public service to limit its impact on service delivery. So, colleagues, this is wonderful. As you will be aware, Cabinet recently adopted the National Health Insurance Bill, and it will soon be tabled in Parliament. As we move towards universal health coverage, the steps that we are taking today will aid us in our efforts. I recently attended the G20 meeting in Osaka in Japan. It was quite interesting to see your more developed economies urging us in the developing economy countries to adopt and embrace universal health care. And they said we should regard and see universal health coverage as an investment because they have seen how it has benefited them. Japan actually was the country that initiated this discussion and spoke quite eloquently about what their own universal health care has done. And as we know, they have a new challenge now with an aging population. And they say we've been able to reach this milieu, if you like, where we have many people who are older, who are still living healthily. People in Japan live way beyond their 90s and so on, and some even hit 100. And they say this has happened because we had a very progressive healthcare system. Now, they were encouraging us, and I would say to those who still have doubts and who still are hesitant about national health insurance, that look at what a number of countries in the more developed economies have been able to do and achieve. And this is precisely what we also seek to achieve. I forever remember, and I'd like to say this in this audience, as a trade unionist, we used to visit Sweden quite a lot because the trade unions in Sweden supported our struggle here as trade unions. I forever remember the story that was told by Olof Palme, who was the Prime Minister of Sweden. He said their first Prime Minister, Ed Lange, I think it was his name, went to hospital. And when he got to hospital, he was admitted in, I think, a 3 or 4 bed ward. And it was a public hospital. And a few days later, another person came to join him in his ward. And he happened to be a steel worker. And he turned to this steel worker and said to him, "My good friend, I am glad you are here. Not that you are ill, but you are here. I'm glad you are here because this to me represents precisely what our struggle for universal health coverage was all about. That you as a steel worker can come and lie in a bed in hospital next to me as the Prime Minister. That is the success of our healthcare system. I forever remember that. And that in many ways is what fuels me, fuels and feeds my commitment that this is one objective, universal health coverage, the NHI, that we must achieve for all the people of our country here in South Africa. And we will. So as we move towards universal health coverage, the steps we are taking today will aid us in all our efforts. The plan of health service users to lobby for improved implementation of universal health access across public and private sectors, as well as the labor movement's commitment to educate communities on NHI, is to be welcomed. This compact that we are going to sign today illustrates what we can achieve when we plan and we work together to fix what is wrong in our country. It has as its stated goal, one country, one health system. This means quality of care must be the same regardless of whether you have money or you do not have money, regardless of where you live. And if we are sitting here, picture the story I told you about the Prime Minister of Sweden and the steel worker. In standardizing the quality of services provided, we will be ensuring better health outcomes. Under one health system, patients are treated with dignity, with respect, with compassion, also with passion, regardless of their social circumstances. This is what we expect, not just in the healthcare sector, but across the public service as well. By the same measure, patients must also respect healthcare workers. Under one health system, all our hospitals, clinics, doctors' rooms are appropriately staffed and resourced. There are adequate medicines, equipment and supplies, and infrastructure is suitable for the services to be provided. Working in partnership, we have developed action plans with key interventions aligned to the 9 pillars that Dr. Mkhize spoke to. There will be an expectation to meet these commitments within allocated timeframes. As we forge ahead to give effect to the constitutional right to access to health care, assenting parties commit to execute their responsibility in an ethical manner and to ensure that self-interest does not derail or detract from this goal. They commit to working and also participating actively in structured program teams with clear role allocation and responsibilities. The partners commit to supporting transparency in funding modalities and impact assessment and to promote inclusivity in the dissemination of information. The parties to this compact that we are going to sign further acknowledge that because it is a dynamic and organic document, it may require continuous review depending on the monitoring and evaluation of the stated outcomes that we have put together. Access to quality health care is not just about a healthy body and a healthy mind. It is also about a healthy society in which all our people are able to pursue their interests and achieve their potential. Speaking at the Medunsa graduation ceremony in 1991, the founding father of our democracy and nation, President Nelson Mandela, described the importance of healthcare in these terms. He said, "There cannot be peace while our people lack basic social facilities, including basic health care. There cannot be peace," he continued, "while the overwhelming number of doctors and medical facilities are concentrated in areas accessible only to a small section of the population, close quotes. With the signing of this Presidential Health Compact, we are closer to the fundamental transformation of our healthcare system. Through our actions, we are bridging or bringing our collective energies together to bear to be of service to our people. And we are working together towards achieving redress, a redress of our healthcare system that is much needed. We are working together for the public good, for social cohesion, for economic progress, and, as Madiba said, for peace in our country. We are working together towards building this South Africa that we all want. And this is what today we are signing for as we sign this Presidential Health Compact. And I'd like to thank all those who participated once again in crafting this health compact, the hard work that you put in. Prior to the presidential summit, I had a number of consultations with a number of diverse groupings of our people who at the time were pulling that way and that way. And I'd like to applaud you, and many of them are here today. I'd like to applaud you for having had the courage, the commitment, and the determination to finally get our country to where it is today. Because this is the building block of getting South Africa to move forward. This is the building block of making sure that finally we get the South Africa that we want. This is the best day for our people to ensure that our healthcare system is now going to be put on a much stronger footing, where all the people who are active in the healthcare center are going to participate together with our people on the ground to ensure that we do indeed accede to having a healthy South African population. I thank you for all the work. Thank you.
Thank you, Mr. President, for your words. I will take an opportunity to share a few vocabulary that we have in labor ward, because male nurses who are helping in delivery of babies in labor ward are not called midwives. Actually, they call themselves okachas. I hope I've pronounced it quite well, but they call themselves okacha. Okacha was one of the first nurses in France who actually worked in labor ward to deliver babies. Thanks again, Mr. President. We are going to read the compact now, the compact that is going to be signed, and different stakeholders will be then called after the President and the Minister have actually signed. The compact reads as thus. We pledge with this compact, insofar as it falls within the area of our responsibility, that government and all other stakeholders will collaborate towards establishing a unified, integrated, and a responsive health system that provides access to quality health care. To work collaboratively together towards realization of universal health system that applies uniform health standards throughout the system, serves the whole population, and embraces accountability and transparency in the implementation of this compact. To consider this compact as a living, dynamic document that is contextual and may require continuous review depending on the monitoring and evaluation of the outcomes and contextual issues. We hereby commit that the articles hereunder provide the anchor for collaboration between government and all other stakeholders to work jointly towards improving the public and the private health systems in the Republic of South Africa. Article 1. Government and all other stakeholders will work towards the primary goal of the Presidential Health Summit Compact, which is to strengthen and improve universal access to health and health care in South Africa. To achieve all this, all parties commit to this goal and ensure that self-interest do not derail or detract us from this. Article 2. Government and all other stakeholders will jointly implement health system and service improvement plans, which will comprise of the following 9 pillars. Pillar 1, augment human resource for health. Pillar 2, ensure improved access to essential medicine, vaccines, and medical products through better management of supply chain, equipment, and machinery. Pillar 3, execute the infrastructure plan to ensure adequate, appropriately distributed, and well-maintained health facilities. Pillar 4, engage the private sector in improving access, coverage, and quality of health services. Pillar 5, improve the quality and safety and quality of health services provided with focus on primary health care. Pillar 6, improve the efficiency of public sector financial management systems and processes. Pillar 7, strengthen the governance and leadership to improve oversight, accountability, and health system performance at all levels. Pillar 8, engage and empower the community to ensure adequate and appropriate community-based care. Pillar 9, develop an information system that will guide the health system policies, strategies, and investment. Article 3 says that government with all other stakeholders will serve the whole South African population with specific focus on marginalized and the vulnerable, so that all people are able to use the health services they need without financial hardship and no one is left behind. Article 4, government and all other stakeholders will embrace accountability, transparency, and good governance while implementing the proposed intervention included in this compact. Article 5, government and all other stakeholders will ensure consistent and regular communication with each other, with the nation on the progress made to improve the quality of the health care system as outlined in this compact. Article 6, a joint technical monitoring team comprised of the National Department of Health and stakeholders representing health professionals, labor, business, civil society, health service users, academic and research, statutory research councils, health entities, traditional health and allied health professionals will be established to do the following: oversee the implementation of this compact by using monitoring and evaluation framework based on the health compact action plans for each pillar, ensure effective and sustainable collaboration among all stakeholders for delivering on the key outputs of each pillar, meet quarterly to consider and review progress reports from the accountable department and other stakeholders. The joint monitoring team will report annually to the Presidential Health Committee defined in the full compact accompanying this document. Article 7. The signing of this compact reflects our intention to work towards the achievement of the objective and agreed interventions contained in this compact, and will be championed by the President of the Republic of South Africa, led by the Minister of Health and the representative of all the other stakeholders signing this compact. B, be allocated the necessary resources by government in accordance with the Public Finance Management Act of 1999 and all the other stakeholders to support its implementation. Mobilize the entire health sector in the spirit of renewal to meet the commitments made in this compact. Article 8, this compact must be interpreted in accordance with the spirit and purport of the Constitution of the Republic of South Africa, 1996, and all other law applicable to it. Article 9, which is the last one. This compact enters into force on the date of the signature thereof, the undersigned being duly authorized here to have signed and adopted this compact. And on behalf of the government of the Republic of South Africa, His Excellency the President, Matamela Cyril Ramaphosa, will sign, and the Minister of Health, Dr. Zwelini Mkhize, will also sign. And that's a long signature. On behalf of business, as the President completes the signing, we'll call Mr. Stavros Nikolai, who's going to sign on behalf of Business Unity South Africa, and Mapaseka Litseki will represent civil society, which is the Deputy Chairperson of SANAC and the Chairperson of the Civil Society Forum in the country. We're going to run out of chairs. They are signing almost 9 copies with accordance to the 9 pillars. So everyone must be able to put it into the space. We'll also... Okay. Have you signed? You must start signing. Can we call Dr. Kutsie also to come forward on behalf of the health professionals, on behalf of all of us health professionals? Even if I'm a MEC, I still remain a health professional. I pay my dues, Dr. Klape, HPCSA, that I continue practicing, and then I don't practice illegally. That's it. first three is done. Okay. Just to remind the representatives that have just signed about Article 9, that it says that this compact enters into force from now on, from date of signature thereof. So we are not going back to where we are from. So it's just a reminder to the representatives of the social partners and also of the minister and the president. The next three that we're going to call on behalf of Labour will be Mr. Begin Chalinchali, the overall convener of Labour in NEDLEC, the health service users, Ms. Lauren Pretorius, the CEO of the Campaigning for Cancer, on behalf of the academic and research, Professor Martin Vella, the Dean of the Faculty of Health Sciences at the University of Witwatersrand. Tiger. How are you, Prof? Thank you. Yeah, I did ask for some music, but I thought we were going to play a bit of Gqom or Java from Pretoria. But I think anything will do for now. The next group will follow on behalf of the public health entities, Professor Mike Sateche, who is the president of the South African Medical Research Council. On behalf of the Statutory Health Councils, Dr. Kgosi Letlape, the president of the Health Professional Council of South Africa. And on behalf of the traditional health practitioners and allied health professionals registered by Allied Health Profession Council, Dr. Kendra Da Silva. And traditional rhythms. Of all of them. Okay. Where? Okay. So they've signed them. Okay. Can we have all the stakeholder representatives to come back to the stage? Can we have all, Mr. Stavros, to take the last photo with everyone just after the signing? After that will be my last call for today. The vote of thanks will be done by... We'll have to remove the podium for a photo with the president, and we just have to move the podium so that we allow everybody space. We are at the end of the program now. What?
Can't we get back?
I think we need the podium back. It's just for completeness sake. We are almost done with the program, and thanks for your attention. I'm going to hand over to Ms. Lebu Mulaisi. Got it right, no? Okay. Who's going to do a vote of thanks on behalf of the team? Thank you.
Thank you very much, Program Director. Afternoon all. Afternoon, Mr. President, Minister and Deputy Minister of Health, Program Director, Health MECs, signatories of the Health Compact, as well as all protocol observed. I'm in a very tight position. I stand in between everybody and their lunch, so I'm going to make this very quick. I am in a fortunate position to thank everyone that has played a key part in ensuring that we have a Compact 2 signed today. So it's a long list, but I promise I will make it as quick as possible. First of all, I'd like to thank the President of the Republic, President Ramaphosa, the self-proclaimed, you said it was a doctor in marriage. Thank you very much. By marriage. Yes. I must get that one right. Doctor by marriage. Thank you very much for pioneering this work, for locating it in the presidency. This means a lot. This has allowed us to do our work with the efficiency that it deserves. Thank you very much for noticing how important health is and that it's an investment rather than it be seen as just spending on the part of government. So thank you very much for that. I'd like to thank the former Minister of Health, Dr. Aaron Motsoaledi, who we have done this work with since October last year. So in his absentia, we'd really like to thank him. He has really made sure that we had all the inputs that we needed for this work from a provincial level as well as at the national level. I'd like to thank the current minister, Dr. Zweli Mkhize, as well as your deputy minister, Dr. Pasha. Thank you very much for finalizing this work for us. Had it not been for your finalization and how quickly you guys have done this work, we would not have been today. After an engagement with another minister in another department who highlighted that you guys have only been in this work for 40-something days. So thank you for working as quickly as you have. This ensures that we have this compact today. Thank you for all the signatories that have penned their signature, put pen to paper. This gives us the mandate that we need to run with this work. We are given a time frame of 5 years to ensure that we bring the compact's interventions as well as commitments to finality. So thank you for the mandate. No one has an excuse. It's time to kaoleza. Thank you very much to the various members of the steering committee. We had the benefit of working with the best minds in the country. Thank you for availing yourself on a volunteer basis. No one was paid, I believe, unless I'm the only one who's not in the know. Okay, so no one was paid. Thank you very much for volunteering yourselves in clear Tumamina spirit. Thank you for, our Fridays were synonymous with the Union Building West Wing. That's where we spend most of our time for hours and hours on end. Thank you for volunteering your weekends, your time after work, time away from your children to be with us. Some it's time away from their grandchildren. But thank you nonetheless for being with us to do this very important work. We appreciate every single one of you. Thank you for, really, from the bottom of our hearts, thank you so much for the work that you have the time you've invested, the work that you've invested in this great work. Thank you to our secretariat. You guys have been wonderful. Nondumiso, I don't think you know how to say the word no, but thank you. It is in your work ethic It's in the long hours that you made sure that we were able to have this compact. You were the ones that really put the dot on the I's and crossed all the T's to ensure that we have a comprehensive compact that everyone can understand and everyone can easily work with. That's important. And last but not least, thank you to the chair of our steering committee, Prof. Shisana. I want to be you when I grow up. Thank you very much for all the time, the effort, the work. I know towards the end you were kind of making use of emotional blackmail at times and sheer intimidation to get us to work and stick to the tight time frames, but thank you for that. Had it not been for your work ethic, really, we would not be here today. Thank you for making us walk a very tight rope. Thank you for making us keep to all the time frames that we had. Really, if it was not for your leadership, we would not have been here today. I believe even the members of the various task teams that were supporting the various pillars that we have in the compact, thank you very much for availing yourselves. Some of you were flying all the way from Cape Town, coming to Johannesburg at your own cost to come and do this work with us. Thank you very much. Thank you so much. It is this spirit that went into this compact and this steering committee that ensures that we have a brighter future for South Africa. In the very likely event that I have forgotten someone and I did not mention you, I'm going to protect myself now and say thank you to everybody who participated, whatever role that you played, whether large or very small. We acknowledge you, we recognize you. Thank you very much. Thank you, and thank you so much.
Okay, we'll allow the minister and the president to exit the room.